It has been a busy 2020 and 2021 for local health departments like Douglas County. The frustration for the health directors in charge is growing as more work is being asked of these health departments, especially during the pandemic, but funding isn't reflecting the demand.
If I hear the word public health one more time at either the governor's conference or some other event, it always is, well, public health will do that. Ask local public health. Local public health has the capacity to do it. We don't.
Douglas County Health Director Dr. Audie Poor says even before COVID-19, funding, mostly coming from grants and foundations, was scarce.
We have underfunded public health for many, many years.
In fact, the underfunding of public health is a national issue. Take, for instance, the CDC, the nation's leading public health agency. After adjusting for inflation, the CDC's budget has fallen by 10% over the past decade.
Out of all the spending we're putting into the healthcare or the health of Americans, only about 2 to 3% of that is dedicated to public health.
Senator Tony Vargas of Nebraska's 7th District is on the Appropriations Committee in the Nebraska legislature, looking over exactly how state dollars are being spent. He says this week the committee is sitting down to discuss adding an additional $5 million to be spread over 2 years to local public health departments in the state.
I think what we saw this year is they have been underfunded, and we've expected more from them, not less.
If approved, the extra bump in funding would still have to be approved by the full legislature and signed by Governor Ricketts. But Senator Vargas says he's putting his focus on this extra funding after the year public health departments have had. Reporting in Omaha, Rudolph Sinaida,